Good afternoon. Prior to Thanksgiving, I wanted to give everyone another update on the coronavirus in our area. By now, everyone is aware that cases are up throughout Illinois, most of the United States, and most of the world. It is important to note that these case increases are in states and countries with and without mask mandates, with harsh lockdowns and no lockdowns. This shows that lockdowns haven't altered the course of COVID-19. They did, however, have significantly different impacts on the economy. Here in Illinois, we had very tight restrictions, but we are still seeing cases rise throughout the state, which has led to the governor imposing many of the same mitigation measures through executive orders. There is no question that cases are up. Recently, however, cases began being reported differently. Cases now include positive tests from several different types of tests, not just PCR tests. Also, cases now include probable cases, not just confirmed cases. This difference in reporting is also impacting positivity rates. Additionally, we know that COVID-19 deaths have previously reported everyone who died with COVID-19, not necessarily from it. Now, probable COVID-19 deaths are also included, but not defined. If all of this is confusing to you, join the club. Remember that the goal of the initial lockdowns was to flatten the curve in an effort to protect the hospital system. Also, the best data to understand what is happening to the hospitals is COVID-19 hospitalizations by date. While it lags by just a few days, we know when people were admitted to a hospital and if they tested positive for COVID-19. However, Cook County DPH stopped reporting this data about a month ago. In fact, now all of Cook County DPH data is lagging by 5 or 6 days. Moreover, the state now includes COVID-like illnesses in their hospitalization totals. This means that flu, pneumonia, rhinovirus, and others are included as COVID hospitalizations. More recently, the state lowered the total number of hospital and ICU beds that regions and the state have available, which means the percentage of beds immediately was lowered. Why is this important? It is important because historically, many of our hospitals go on bypass, meaning they are full and not accepting ambulances, annually at this time of year. In 2019, Christ Hospital led the way at 20% of the time on bypass, and in 2018, Northwestern was on bypass for over 1/3 of the year. This was prior to COVID-19. Since this information is no longer reported, I have called area hospitals to get a better understanding of what is happening. There is no question that actual COVID hospitalizations are up significantly in the last 6 weeks. However, the hospitals also indicated that they have enough bed capacity, and the issue of capacity is more about staff and nursing capacity, driven largely by parents needing to care for their school-age children who are not in school. Last week, the CDC recommended that children go to school for in-person learning. The governor announced several additional mitigation measures on November 17th going into effect on November 20th, including a recommendation to stay at home. Additional mitigation measures and closures were placed on bars and restaurants, health and fitness centers, hotels, museums, indoor recreation facilities, movie theaters, and organized recreational activities. Unfortunately, the common denominator for all of these industries is that they have had 0 outbreaks traced to them since July 1st in either suburban Cook County or Will County. As you recall, Illinois never opened up completely. We were told that this would prevent a second outbreak. The fact is, limiting much of our economy to stop a second outbreak did not work. Now we are being told it is because we didn't listen. Like you, I have observed that more people and businesses are wearing masks and taking precautions than in May. IHME data tracking mask usage and social mobility supports this observation. In other words, it is not because we didn't listen. It is because the measures did not work. Since they did not work, why are we trying the same mitigation measures again? If any of these industries were driving the case increase, I would be more than willing to support fact-based mitigation measures. However, the facts do not support these decisions. The damage caused by these mitigations is not insignificant. Soaring unemployment, business closures, destroying complete industries and the jobs they provide, mental health issues, increased suicides, and an increase in domestic violence incidents, to name a few. Not to mention the damage that we are doing to the mental health, nutrition, and education of our children. We also know that 51% of the deaths are from long-term care facilities. Additionally, according to DuPage County, the only county reporting outbreak information, 77% of outbreaks can be tracked to long-term care facilities. Yet there were zero increased mitigation measures put on those facilities. Currently, there seems to be consensus from the state, the counties, the CDC, and the experts I talked to that most of the COVID-19 cases are being caught at home and at private gatherings, not from the tracked outbreaks. The governor also recommended that people stay at home. I wouldn't go as far as to say to stay at home completely, but based on current circumstances, I agree with several recommendations, including vulnerable populations, particularly those over 70 with other serious conditions, should make every effort to protect themselves. If they must interact publicly, wear an N95 mask or equivalent for protection. Long-term care facilities should enact extra safety precautions to protect their residents and ensure visitations are safe. Work at home if you are able. Keep your trips to other businesses as short as possible to limit exposure times. Ensure that you are exercising and get outside where possible. If possible, periodically open your windows and ventilate your house and/or businesses. I know this is difficult in the cold, but it is helpful. Practice social distancing, 6 feet, wherever possible. Practice good hygiene. And stay at home if you are sick. Several area mayors and I recognize that we are not being given most of the data that is being tracked. Therefore, we have asked for the following information to be made publicly available by the Cook County Department of Public Health. Outbreaks by site type, including long-term care facilities, approximate number of total locations for site type in suburban Cook County, number of cases for each outbreak above, occupation for each case, unique cases, not positive tests to eliminate duplication, COVID-19 hospitalizations by date, not COVID-like symptoms. This will allow local officials to evaluate the burden on the system from COVID, separate and apart from seasonal flu impact. Flu hospitalizations by date, intensive care unit beds used as a result of COVID-19, ventilators used as a result of COVID-19, total ICU beds, total ventilators, flu beds used, and flu ventilators used. If we had a robust and accurate fact base, we may actually be able to develop targeted, narrow mitigation measures that are effective. After over 650,000 cases in Illinois, we should have enough facts to enact targeted mitigation efforts that improve our efforts to combat COVID-19. The impact of sweeping and ineffective mitigation measures has resulted in massive economic hardships, other health problems, increased suicides, more mental health issues, and increased domestic violence incidents, and unknown damage to our youth. The citizens of Orland Park in Illinois deserve more transparency so that more targeted, fact-based, and effective mitigation measures can be developed. It is also important to note that it is possible, no matter how hard we try, we will not be able to stop this virus from running its course. The human species does not have a great track record at controlling viruses, even viruses that have been around for a long time, and this virus is new. Of course, we are hopeful that a vaccine will be effective, but that is certainly not a guarantee. This is more than a one-part problem. If you focus on only one part of the virus, cases, then you forget about everything else that is important. The reason for not fully reopening was to prevent a second wave. That did not work. If our actions did not work the first time, why would we take the same actions the second time? I will continue to work with other local officials to get the state and county to be fully transparent. In the meantime, it is important that we continue to take measured precautions to keep people healthy while also not destroying people's lives. For that reason, please take the common sense precautions you are all aware of by now. This Thanksgiving, please remember all that you are grateful for, even in these difficult times. Personally, I am thankful that my family and I live in the greatest country that is the greatest force for good in the world. I am thankful for all the nurses, medical professionals, and frontline workers who continue to work tirelessly through the ups and downs of this awful contagion. I am thankful for those working hard to develop a vaccine to help build herd immunity more quickly. Lastly, I am thankful for all the good Orland Park citizens and businesses who have operated compassionately and safely throughout these trying times. Have a happy Thanksgiving.